All right, gentlemen, welcome to the Eyecelerator Media Wall.
Good to see you again.
Absolutely. So, gentlemen, you have been on a roundtable this morning about Oculomics and AI predicting systemic health from the eye. Can you tell me a little bit about what you spoke about there?
And so today we brought in 7 world experts in Oculomics to talk about their individual projects and also their collective vision for where we're headed. So Oculomics is essentially using eye data to predict and analyze systemic health. We've known the eye is the tip of the spear and the tip of the iceberg for looking at systemic health for a long time. We have now strong data sets across multiple regions in the world showing that that is actually validated. But it is going to take a systems approach to actually bring that to impact global health. And that's where we still need to move forward. And it was fascinating because we had the CMO of Microsoft Healthcare, David Root, with us today. And it was fascinating to hear his perspectives because we need to build a systems approach to be able to integrate these outlooks across healthcare more broadly. And that's not easy to do.
We have rich data sets from retinal images, OCT images, even anterior segment images that are important predictors of disease progression, of risk, potentially of treatment response. Some of the examples include neurodegenerative diseases, cardiovascular diseases. We've already looked at diabetic retinopathy. The eye is the window to the soul, but other data sets like traditional omics, proteomics, genomics, electronic health records, these are the data sets with AI that are going to make Oculomics very powerful.
What real-world applications have been demonstrated by Oculomics so far?
I'll go back to diabetic retinopathy, Alzheimer's disease prediction. Carol Chung came in and gave us some of her use case for modifying the progression to a neurodegenerative disease. We think about Oculomics and the power it could have on a patient level, on a disease population level, but it also flips back to personal wellness. Even the healthy individual might wear a digital wearable. And these data sets are very open source and available to anyone who's looking to innovate and enhance global health.
What steps would you say, Alan, are necessary to go from, say, promising research to trusted tools in Oculomics?
There are a lot of issues that go from privacy of information, HIPAA compliance, AI. We talked about boundaries for ways that AI look at these data to limit and reduce AI hallucinations. There are people that are involved in global healthcare, from payers to diagnostic companies to pharmaceutical companies to providers. I think this is part of the efforts that are being led by Topcon and others on healthcare through the eye.
If you're trying to take this global, you need to be able to think about how do we get hardware into places or change our current hardware like phones to be able to capture images that are useful to use as the eye into the window for systemic health. And so there's a number of companies that are working towards solutions that are more deployable globally to democratize, the word we talked about a lot today, healthcare. As we scale this, ideally machines would be in Walgreens, CVS, where people can get an eye image independent of a physician and get some feedback about their risk profile. That's what the future looks like, but it takes hardware, it takes systems. I really want to highlight Aaron and Cecilia's work out of St. Louis. They've built a one-of-a-kind model, which is an open source access to an incredibly rich data set, right? One of the biggest problems with this space is that all the data is siloed. And there's a lot of IP protection around different algorithms. They are intentionally working in the opposite direction, which is to make open source data so that people can access it and use it for their own commercial interests. And we need more approaches that are open source like that.
Charles, from your experience in large-scale trials, what level of evidence and data integration are going to be needed to bring Oculomics into standard of care?
I think that while there's a lot of groundwork that's been done in Oculomics, there's a lot of opportunity still, but as you point out, that needs to be realized. And part of that is through clinical trials. So what we're seeing in clinical trials, for example, now is integration of AI systems for quality assessment along the way. Is this image of sufficient quality to be able to allow an AI algorithm to interpret the image as needed to perform Oculomics? the first steps to capture the images are critical, and we're just now in the process of implementing software algorithms that can help ensure that data quality that goes into the system is of high quality. And then standardized. For example, if you talk to different retina physicians, we're all doing different imaging patterns. Whereas if we could standardize and use the same scan pattern, we would have a much richer data set. So I think we're learning about the opportunity and realizing that the data in is critically important.
I think it becomes really interesting when we get away from not only disease innovation, disease diagnosis and treatment, but using Oculomics to intervene, predict, and change to wellness in thinking about reducing risk in individual or in populations.
We've used catchy phrases like the eye is the window to the body for a long time, but we're actually now just at the beginning of actually realizing that at population levels. There are algorithms that are being built, there's hardware systems that are being designed for this across mass group patients, and we now need to begin to integrate that. So I want eye care professionals to go into their daily clinics thinking, how can I use this patient and use eyes to actually look at systemic health? We need to take a perspective that we can actually begin to do this as we materialize and come up with the algorithms going forward.
Last word, Alan.
That we are really privileged to have this access. So for example, a direct image to the retina fundus or an OCT image, that very rich data set acquired with quality is being established and shared. It really is going to be a head-to-toe data set on not just the body, but environmental influences, other data sets that I think will be very important to all fields of medicine, and it's coming from ophthalmology.
Well, fascinating roundtable today on Oculomics. Gentlemen, thanks so much. Excellent talk today, and fist bump me out. Thanks, guys.
You're welcome. Appreciate it.